Good morning, everyone. Welcome. This is the first of many video updates that we're going to provide to therapists here in the Southwest region. This was a recommendation of the Employee Advisory Council that we provide video updates as to things that are going on within our region and in our system. But first I want to provide you with a little reflection. The term that we're going to talk about is crackpot. It originated in the 12th century when the Viking insurgents took over a particular village. They called it crackpot. It wasn't a pleasing place, and they left the village. And the crackpot meant at the time a hole where crows gather. Later in the 17th century, the French separated the term into its component parts. Cracked meant faulty or impaired, and pot had the meaning of brain or head. Hence, we use the term crackpot to distinguish someone who has faulty thinking. But I'm going to tell you a little story about an Asian gentleman carrying water from the river to his village. He had on his shoulder a stick with two pots. One was cracked and the other was not faulty. He would fill the pots, and on the way back, the water would flow out of the cracked pot along the way. And when he got back to the village, the whole pot was fine. It contained all the water that he carried, and the cracked pot only contained half of the water he carried. The pot then said to the villager, "I'm so disappointed in myself that, whenever you fill me, all this half of the water leaks out, and by the time I get back to the village, I'm only half full." But the villager told the pot, he said, "Look, I want you to look along the way from the river or the lake to the village. There are beautiful flowers that have grown along the way." And so the point of that whole story and the crackpot idea is that, we have so many different personalities within our organization. Some we may think are crackpots, and others we think are very sane or whole vessels. But the reality is we all contribute to the cause, and even someone that we may not feel fits within our organization or has a different type of way of thinking can contribute greatly and provide a wonderful experience to our guests and great relationships amongst our providers. So I want you to remember that. And I'm going to also tell you a safety story about Kelly Henriksen. She was working in a PMG clinic, Hawks Prairie Internal Medicine, and she actually was referred a patient that had some shoulder pain and some thoracic pain, I believe. She evaluated the patient and determined that something was not right with this patient and the diagnosis of shoulder pain. So upon her assessment, it confirmed her suspicion, and she sought out the primary care provider, the internal medicine physician, and they talked about that patient. X-rays were ordered, and it was determined that that patient was suffering from a compression fracture. And this again shows the tenacious caring, that we want to get it right no matter the cost, the collaboration, how essential it is for our guests and our locations, and again showing the value, the physicians showing the tremendous value that they have for our providers. So congratulations, Kelly, and continue to provide me with those safety stories that I can share in our regional meetings. Thank you so much for that. And again, these video clips in the future are going to be about 3 minutes long. We're going to do some quick updates, and we're going to have them more regularly than once a month, probably twice a month. A few things for you to consider today. Moving forward, there's going to be challenging times in healthcare. We know that. We know that the president is pushing repealing the Affordable Care Act, and as a result, there could be millions of additional individuals without health care, which again is going to increase the burden on our healthcare system. And so we just need to be aware that we are in challenging times, but this is a great organization. Our mission and values are significant, and I want all of you to remember we need to support one another. We need to encourage one another. We need to continue to be patient, to be kind, thoughtful, and supportive, because we have some challenging times ahead, but we can get through it. And again, we believe in tenacious caring and caring for our guests no matter their ability to pay, and that is what excites all of us about Providence, I believe. I want us to remember that Angie Woolley is on a campaign to glean information on how your position on our organizational values. So start thinking about our organizational mission and values. When she comes to your facility, she's going to ask you to share your perception of the mission of the organization. So be aware of that, which is upcoming fairly soon. In our acute care environments, I know that you guys are working very hard. I know that Trish was a part of a meeting which considered throughput in both locations. They're talking about ways to increase our efficiency so that we can do more, but I would ask that you as therapists at PCH and PSPH be determined in your resolve to make sure that we're providing skilled care. You will be asked to do things that ethically you may not feel is appropriate. So be firm. We are here to provide skilled care in our environments, and nursing needs to participate in the patient's mobility. So where necessary, do a little pushback if you're asked to treat patients you feel aren't skilled in your locations. We are here to provide skilled therapy. And again, I appreciate your efforts and energy in those skilled environments. There's so much that you need to do on a day-to-day basis. Continue your good work. And IPR, the last update quickly is IPR. Our census is a little low, but I'm so happy and amazed at the outcomes that you provide our guests and the quality of service that you provide in this location in IPR. And again, we have excellent therapists with a high level of quality and expertise. And again, we just really appreciate the work you're doing. We're going to provide you with a few more updates in the future. We're going to probably pick a couple of departments with every update, but appreciate what you're doing and continue the good work in your locations.